Okay, I'm starting your webinar. All right.
Hello and welcome. My name is Lisa Zingman. I am a senior advisor at ACF in the Office of the Assistant Secretary. Thanks all for joining us today. We'd like to start off with a poll to see who is joining us today. So you should have popped up on your screen. So take a moment to answer the poll when you get a chance. We are recording this session, and we will share the slides and recording on the Data Strategy webpage in the coming weeks. We'll have about 30 minutes of presentation today and then time for question and answer. If you have questions or comments, please use the Q&A function in the Zoom, and we'll be sure to answer them at the end. Now, let's see who we've got here. Just give us another few seconds, folks, to respond. Okay. We have about 25% joining from federal government, 31% from government contractor, or industry, or think tank, or research organization, about 15% from state government, about 3% from county or local government, but 16% from nonprofit or other grant recipient, 3% from community organizing or advocacy, and 8% other organization. Thank you so much. I'm glad to have you all today. And now I'll turn it over to ACF's Deputy Assistant Secretary for Policy, Jen Canistra, for opening remarks.
Hi, everyone. I'm thrilled to be here today to kick off this presentation on the ACF Data Strategy. For over a year and a half, a dedicated team from ACF has been working on this inaugural ACF Data Strategy. We know there are pain points for many of you working with or related to ACF data, and this strategy proposes a long-term vision we will work towards while also laying out a set of actionable near-term initiatives that we hope will address many of those pain points. As you can see in the note from Principal Deputy Assistant Secretary Jeff Hild in the strategy outline, ACF leadership is fully supportive of this strategy so that data delivers for ACF's mission. Staff and leadership across ACF will continue to collaborate with each other and many of you on implementation of the data strategy and its initiatives. I look forward to seeing the progress we can make together to improve data at ACF. And finally, I want to thank the specific team members who worked on this strategy: Jane Young, Lisa Zingman, Beth Ann Barnes, Kevin Duvall, and Sarah Esty. And now I will turn it over to Beth Ann for the presentation.
Hi, everybody. Welcome. We're so glad that you're here and for the opportunity to share with you ACF's inaugural data strategy. Quick overview of where we're going through today. We're going to start out with why ACF is investing more in our internal data capacity and the motivation for doing this. We'll also be sharing ACF's data vision and our roadmap for getting there. Okay, so starting out, the Administration for Children and Families is a division of the U.S. Department of Health and Human Services, and we promote the economic and social well-being of children, families, and communities. ACF administers more than 60 programs with an annual budget of more than $70 billion. making it one of the largest federal entities working on human services programs. And ACF works with states, territories, tribes, and community organizations to provide funding, strategic partnerships, guidance, training, and technical assistance to achieve those ends. Internally, ACF is comprised of 22 offices employing approximately 2,000 staff. This includes ACF Central Office in Washington, D.C., as well as 10 regional offices around the country. And our programs fund human services across the lifespan, from early childhood to youth and adulthood, from Head Start to cash assistance for families. This data strategy is for all of ACF, with impact across the human services ecosystem. For implementation to succeed, engagement is critical from each program office, all of our grantees, as well as the individuals impacted by the programs, and the support offices internal to ACF that focus on technology, data, and research. At the heart of these programs is the need to address real human needs, and data can help us do that. For example, what if we could save parents precious time in finding nearby quality childcare, or reduce the timeline for matching unaccompanied children to sponsors, or deploy anti-human trafficking funds to places based by the scale of need in those communities? We could also streamline social worker ability to connect vulnerable youth with secure housing and mental health resources, or know before a hurricane lands the communities and providers that will need help recovering and what they need to help recover. And what if we could quickly pre-enroll people to any eligible service, regardless of which avenue they start with? At ACF, we recognize that better data capacity internally and throughout the human services ecosystem can lead to improved operations, more informed policy, and faster, more proactive, and safer delivery of public benefits and services. Our data strategy is a public commitment to do the necessary work within ACF and in partnership with our grant recipients and other implementation partners to turn these what-if scenarios into a reality. And this really drives ACF's data vision, which is that data delivers for ACF's mission, whether we're developing policy, streamlining operations, setting standards, or sharing the story of children and families across the nation. ACF uses the power of data to continuously improve human services and transform communities. And because words matter, we thought it was important to break down what we mean when we say that. When we talk about data, we're taking an expansive and comprehensive view, referring to quantitative and qualitative data that's both administrative and public information in nature, with a focus on improving programmatic and operational decisions. And we're using that data to deliver on mission and increase impact, not just for the sake of having data. The type of work that we're using data to support includes increasing service delivery quality, improving internal efficiency and collaboration, and communication within ACF and in the broader human services ecosystem. A key part of that vision is unlocking that potential to support operations, research, and evaluation through committed leadership, reliable infrastructure, human capital investments, and established practices to collect, manage, and analyze data. And data use doesn't just happen once. The vision is to use data dynamically to measure and monitor the decisions that, if the decisions that we make have the intended positive effects, so that we can continuously improve. In developing the data strategy, we used the ACF Evidence Capacity Framework to articulate what achieving this vision looks like in terms of culture, infrastructure, human capital, our ability to engage with others, and leadership. At Full Vision, ACF routinely uses data to support our mission objectives, program and policy choices. And we constantly ask questions about our work and effectiveness and use data to inform answers and decisions. And every office across ACF has the tools, systems, resources, routines, policies, and processes to build and use data in a timely and efficient manner. This vision also looks like within ACF, we have the knowledge, skills, and abilities to meaningfully leverage data and communicate insights clearly, as well as the systems and processes that promote collaboration within and across internal and external audiences to advance informed and equitable data use and evidence building. And finally, ACF leaders foster a data-informed culture, identifying opportunities to meaningfully leverage data, allocating staff and other resources to support data activities within existing budget constraints, and make decisions transparently based on data. Now, we all know that in a world where data can be leveraged for both helpful and harmful purposes, how we achieve our data vision is just as important as what it looks like. ACF will apply human guiding principles when advancing the effective use of data to achieve more resilient, safe, healthy, and economically secure children, families, and communities. And when we say human, we're talking about holistic sharing of data that supports equitable, better, whole person, whole family, and whole community service delivery. And it's useful. We want to be intentional about what we collect and for what purposes. Throughout this work, it's important that we are moral, ethical, and responsible stewards of data, and that we are applying data to integrate insights from data into program design and operational improvements as quickly as possible. And finally, nurtured. As we go about this, we intend to cultivate a collaborative and harmonious data culture across the agency and with our partners. Now that we've outlined where we're going, it's time to talk about how we're going to get there as we've laid it out in this inaugural strategy. Our data roadmap spans 12 long-term, interrelated, and interdependent initiatives that we'll walk through in a moment. I do want to note that on this slide, you can see the nature of how they are interdependent and interreliant and designed to inform and support all aspects of the data vision collectively. Now, achieving ACF's data vision will take many years, so we have intentionally not defined an end date for this strategy. Already, we are making real progress on these initiatives with the existing resources, and we're already reprioritizing data staff, contractor support, and budget to align with these data strategy initiatives. The first category of initiatives are our sustaining initiatives, which are designed to ensure that the data strategy is long-lasting. And these initiatives are designed to create the foundational infrastructure needed for sustainable and responsible implementation of the data strategy for years to come. The first piece of this, the first initiative, is to hire an inaugural ACF Chief Data Officer, establishing an agency-level data policy and management lead within ACF's Office of Planning, Research, and Evaluation. Prior to this action, ACF was one of only 2 HHS operating divisions without a CDO. And our CDO will be accountable for the implementation of this data strategy and represent ACF and HHS's departmental level data governance board. We are in the process of exploring the establishment of an Office of the Chief Data Officer, providing shared services in support of this vision. The second key initiative is developing a data investment funding plan. ACF will leverage existing resources and create a longer-term funding plan that establishes sustainable resources for the core internal data capacity. This is designed to enable offices to have the data systems, staff, and capacity needed to fully support ACF's mission. In addition, we'll explore establishing public-private partnerships to strengthen the broader human services data ecosystem. Currently, ACF's agency-wide budget structure lacks allocations for sustained data investments, and some of our offices are limited in hiring data staff or building data systems due to this lack. The funding plan will explore and address current statutory and administrative barriers to sustainable resourcing. The third initiative is the establishment of an ACF Data Governance Council, which we will be launching in 2024. And this body will serve as an agency-level representative body that provides centralized guidance and decision-making on data policies, processes, guidance, and initiatives applicable across the agency. Prior to this strategy within ACF, data governance practices were largely decentralized across programs. However, offices frequently have common data governance questions, such as how to best collect certain variables or responsibly share aggregate data. With the establishment of our Data Governance Council, ACF stands to improve the effective management and use of administrative and research data while minimizing duplicative demands on staff time, saving costs, and expanding access to data consistent with privacy and security requirements. Our second group of initiatives are what we're calling one-stop shop initiatives, which are really designed to help support our ACF programs by creating dedicated and centralized resources to support the ACF office's efforts to build their own data capacity. The first initiative in this category, in this group, is the establishment of a data talent center. ACF's Data Talent Center is designed to equip offices with the resources and support that they need to recruit, ramp up, and retain data talent. It is particularly challenging for the federal government to compete with the private sector for these resources, partly due to the unfamiliar and complex federal hiring process. The Office of Personnel Management recognized this and launched a government-wide action to make it easier to hire data scientists, and ACF's Data Talent Center is designed to take full advantage of that opportunity and go further to recruit, ramp up, and retain those in-house data talent skills augmented by contracted support. The second initiative is the open data expansion, which is designed to make federal data more accessible to everyone through public and secure access. And this is designed to increase transparency and trust in the government and advance learning. Currently, the data ACF collects is varied in its level of accessibility and machine readability. The data that ACF has released publicly is also spread across multiple websites and various access locations. To make it easier for researchers and other external partners to locate data and uncover insights about ACF-funded programs, ACF will build a cohesive open data plan for data produced or managed across the agency. And this work includes creating new data governance structures and technical infrastructure for secure access, increasing ACF's internal data capacity, implementing common metadata standards, and ensuring best practices in security, ethics, and integrity, while we work to increase access to publicly available data in accessible and appropriate repositories. As a first step, ACF has released a public data catalog on healthdata.gov with information about the data ACF collects, where it may be accessed, as well as relevant data resources. And the final initiative in this group of one-stop shop initiatives is the establishment of a privacy policy center. The data that ACF stewards across its programs interact with a complex web of federal and local data privacy laws. The ACF Privacy Policy Center at Full Vision will help ACF staff and partners confidently navigate the existing statutory landscape to enable human services data to be used and shared more effectively, consistent with those statutes. The Privacy Policy Center will focus on ensuring consistent understanding of data privacy requirements, encouraging and enabling the responsible sharing and analyzing of data across programs, and for analysis, and support the responsible release of open data. At Full Vision, we are anticipating that the Privacy Policy Center will provide training and technical assistance for ACF staff, grant recipients, and other partners, and include a website with guides, education materials, and points of contact. The third group of initiatives are what we're calling delivery initiatives, which are really centering ACF's data impact on ACF's mission from the start. These are centralized resources that can be deployed to support all of ACF. The first initiative in this category is the establishment of data surge support. The need for different types of data support shifts over time and domain. But when a need arises, ACF staff and programs often need that support quickly, right? A particular program has an urgent need for data that exceeds their existing staff or contracted capacity. For instance, when survivors of extreme hurricanes need support, programs must quickly identify, coordinate, and analyze data across ACF and with other federal partners like FEMA. Similarly, when executive orders are issued, like the executive order on transforming federal customer experience and service delivery to rebuild trust in government, it's essential that ACF move quickly from concept to practice, systematically understanding the needs and interests of our partners, identifying existing data strengths, and rapidly filling gaps to enable effective operational changes. Individual offices within ACF currently have limited ability to scale up their data teams quickly, but across the agency, there is no shortage of work to do. Therefore, we set up a flexible bench of data strategists, policy experts, analysts, scientists, engineers, governance specialists, basically every type of data expert that you could like, so that offices can quickly tap deep technical expertise to improve operations and address discrete, thorny data challenges, designed to help ACF respond swiftly to emergent needs and dive deep into high priority topics. The second initiative in the delivery initiatives is the establishment of analytics campaigns. And these are designed to accelerate progress on cross-agency priorities. These campaigns will focus on dedicated resources with apologies. These campaigns are designed to focus dedicated resources to address and advance a specific priority on an accelerated timeline. ACF leadership will sign off on the particular campaign theme and a set of near-term deliverables that meaningfully move the needle on a cross-agency priority, while laying the foundation for scaling up similar work for other use cases. I'm pleased to share that our first campaign, entitled People and Places, will focus on improving ACF's data on the people it serves and where they are being served. And the campaign will prioritize improving the data ACF collects to support improving the data that ACF collects for these two purposes, as well as developing new analysis products and releasing additional data to the public, grantees, and communities. And the final initiative in the delivery initiatives are the creation of community-centered data tools and stories. ACF is uniquely positioned to use data strategically to provide a national view of the state of human services across the country. Building on the open data expansion, ACF will make human services data more accessible by creating visual data essays that combine administrative, research, and open data across the agency. We're already seeing examples of this approach to visualizing data through tools such as the Office of Community Services Disaster Flexibilities Hub and Water Assistance Program Dashboard, and the Head Start Environmental Exposure Map tool. While this work has happened within specific programs, with the commitment of additional resources, ACF's vision is to help shape the narrative of the state of children, families, and human services by more regularly publishing data tools and stories, and creating a landing page on ACF's website, consolidating links to published tools and stories of this type. And with that, I'm going to turn it over to Jane Young to talk about our technology initiatives.
Thanks so much, Beth Ann. And I'm also actually going to initially pass the mic to our Chief Technology Officer, Kevin Duvall, for a brief introduction.
Hey, so good morning, everyone. I really appreciate everyone joining this webinar. You know, I think we almost have 200 folks on, obviously very interested in how the Administration for Children and Families uses its data and how they will use this strategy to push our data further to help the people that we serve. You heard 3 out of 4 parts of it, which was sustaining initiatives, one-stop shop, delivery, and then the 4th part is our technology. Data doesn't work without technology. Technology doesn't work without data. And if you've been following any of the hype around artificial intelligence really doesn't work without data. And so you'll hear from Jane talk a little bit about our technology and how we're going to move that forward and advance it to support data. But this is a partnership across ACF. It's really exciting. We welcome feedback and ideas from this. One of the key things, I was responsible for a lot of COVID data during the pandemic. It requires public input and feedback to make this successful. And so I strongly encourage you to use the Q&A and follow up with us thereafter on your ideas and thoughts about what we should do to make this successful. So really appreciate it. And I'll turn it back to Jane to talk through our technology.
Thanks, Kevin. So as Kevin said, you know, the investments in technology are really critical to streamlining the availability and reliability of our data, and also to help really coordinate and collaborate across ACF and with other constituents. So there are 3 initiatives that we have under the technology category. The first is around data tools and infrastructure. You know, whether there's a data scientist who's forecasting the impact of climate change on human services, or we're analyzing thousands of survey responses to better understand how a program can be improved, there's a common set of data tools and infrastructure that our data talent needs. We have multiple initiatives underway to provide our data talent with those tools and infrastructure so that they can conduct meaningful projects without the upfront friction of figuring out what can I actually use to do this analysis. So this infrastructure includes platforms that will allow linking large data sets securely, platforms to enable responsible applications of artificial intelligence, as well as your just bread and butter data visualization, survey fielding tools, and the like. We're also really thinking about how technology can help us better connect within ACF and with our constituents outside of the agency. This is where a customer relationship management system, or CRM, comes in. ACF, we support thousands of grant recipients, many of whom receive funding from multiple programs, multiple offices within ACF. With an agency-wide CRM, we can facilitate more important knowledge sharing between our staff so that we can better align and deduplicate support efforts, like when we're doing training and technical assistance. And we can also integrate critical data sources from across ACF, partners within HHS, so that we can ultimately improve the customer experience of our grant recipients in the states, tribes, local, territorial governments, as well as community-based organizations. And then last, but certainly not least, we have to talk about interoperability. Whole person service delivery is a key priority for the Administration for Children and Families, and it depends on having really effective flow of information between service providers. That exchange of information, it can be accelerated through establishing human services data interoperability standards. So that means common definitions and formats for when core information is collected, it's stored, and it's exchanged. We can also improve interoperability through better governance standards, like how do we manage consent when it comes to sharing data? And thinking about how we improve the flows, these business processes, when at the provider level, data is exchanged for specific purposes like case management or screening or referrals. Now, ACF, we've been supporting human services interoperability for years, but there's room for acceleration and for growth. With our data vision, our data strategy, we envision ACF taking a stronger leadership role in establishing data interoperability standards for the human services ecosystem. And we're doing that through coordination, through financing, and through demonstration projects. With additional resources invested, ACF is going to do this work in partnership with the Assistant Secretary for Technology Policy, Office of the National Coordinator for Health Information Technology, so recently rebranded as ASTP, and they're designated in the HHS data strategy to lead the development and harmonization of interoperability standards between health and human services. We can go to the next slide, please. So that was a lot. We covered what is ACF's vision for data delivering for ACF's mission, what that looks like, how we'll achieve it. There's an incredible amount of opportunity to improve human services through the effective and responsible use of data. And that ultimately improves outcomes for children and families. Whether it's informing meaningful policy improvements or increasing access to our programs, we see data as an essential mechanism to delivering ACF's mission. One thing that you may have noticed is that we intentionally did not put an end date on this strategy, and that's because it will take many years of work and substantial resources to truly achieve this vision. We're making meaningful progress in the coming years with our available resources, and we welcome partnership with frontline organizations, data talent programs, industry, and research institutions to advance this strategy. You can reach us at datastrategy@acf.hhs.gov, and you can find our full strategy document as well as later on the recording of this webinar on our website linked on the slide. Thank you so much.
Thank you, Jane. If you have questions or comments, please put them in the chat or in the Q&A feature. We are very excited to have you all on the line. We have one question to get us started. Laura asks, will you be collecting applied data as well as the current requirements of the clearinghouse for systematic data review as they have been defined? Beth Ann, you want to take that one?
Sure. So I think the question there was referencing the What Works clearinghouse associated with one of ACF's programs which OPRE administers. And the ACF data strategy is really much broader than just one particular stream. So the goal here is for us to focus on collecting the data that's useful and can be applied to improving programmatic, operational decisions, in addition to the research and evaluation data that we collect through those dedicated studies. Any particular decision is going to be made based on what's most useful and helpful to advance that particular use case that we're working.
Thanks, Beth Ann. The next question, currently ACF OPRE's data from research projects is made available publicly and with restricted use through entities like the Child and Family Data Archive at ICPSR. How will the Open Data Initiative affect the use of such data archives, which include data across different federal departments?
Yeah. So one of the things that we're keeping in mind, so we're still in the process of developing the full open data strategy. One of the things that we're keeping in mind as we work through that is the value of co-locating existing data with other data of a similar type. right? Which is one of the reasons why we use multiple different data archives that are currently available, because they're targeted towards the particular programmatic domains. And we see value in that. And we don't want to disrupt or make anything harder for folks to be able to access the data that we're making available through either public or restricted use settings. In fact, we want to make it easier to find those resources and build out on those domains. So in process, but priorities are to make things useful, easy to use, and easy to find.
Thanks, Beth Ann. Another attendee asked, is it forecasted to include de-identified OSRIs from the CFSR from across the nation to showcase how other states are performing? That way there can be qualitative analysis for best practices from other states.
You know, one of the things that we really value through these process are all of the useful suggestions and specific suggestions on particular data sets and data streams that could make data more useful to folks in the community and what those use cases are. So that's one that we can take back and talk through in particular coordination with that entity to make sure that doing so would actually be beneficial to the community and also could be done in a way that's consistent with our moral responsibilities to maintain privacy and security and to treat the data in a way as promised by the agreements under which we are collecting that data.
Thanks, Suzanne. The next question, due to longevity of civil servants, would you invest in training existing staff on data analysis, data projects, et cetera, balancing out reliance on outside contracting and hiring of data professionals?
Yeah, so the Data Talent Center, I have to tell you, each and every one of these initiatives is my favorite. And the reason why the Data Talent Center is also one of my favorite initiatives here is that it is really focusing on that entire spectrum, right? So the intent is for us to recruit people in, right? The expertise that we need into the federal service, as well as recruiting the right talent that we need on contracts and contracted support. Once we've got folks here, how do we support them, right? In ramping up their skill sets, providing dedicated training, really focusing on retention so that they've got an incentive and a desire to stay with us, especially given the dedicated program and data set specific expertise that's developed through that ongoing work in that specialized circumstance. And those pieces all go together. Our federal staff are certainly a key component of that, in addition to strategies to make sure that we're augmenting that with contracted staff as appropriate and applicable.
Thanks, Beth Ann. The next question, at this point, do you have any considerations for how academic or applied researchers create content? For example, in terms of code available in open source, priority for dissemination beyond academic articles via apps, and if so, RFPs for the creation of those types of more accessible materials?
Yeah, so the researchers and academic communities certainly play a valuable role, not only in the creation of code and apps and standardized additional documentation, all of these pieces. And being able to facilitate the sharing of that is certainly an important component. One of the things that we are working on through the open data strategy and through is, in fact, the first part that's being released publicly is ACF's public access plan, which actually will require that data and associated pieces produced on grants primarily with the academic community and other researchers will be, and if it's associated with an article, right? So articles, peer-reviewed articles, as well as data and associated pieces will be required to be reported to a centralized repository so that they can be accessed and shared, and we can facilitate even further sharing of information, including secondary analysis and reuse of some of those sources. I won't go into more detail now because that will be coming out soon, which is very exciting. Yeah, did folks want to build on that at all? I feel like it's been the Beth Ann show a little bit. Okay, well, that's great.
Thanks. Somebody asked, how does this inaugural data strategy overlap with the agency's equity efforts?
Yeah, so equity is a core component of data, right? Not only in terms of data equity and our how we're representing people in our data, but also how we're feeding data back out to help inform the conversation, what analysis we're doing, and making sure that as we're approaching this, it's mutually supportive of and respective of the communities that we're serving. And we've embedded various components to support the equitable use of data throughout the data strategy. Perhaps one of the most notable pieces is that our first data campaign is dedicated and devoted entirely to supporting people and places. And it's going to include things like implementing new data definitions and data standards for how people represent themselves, right? So the demographics, so that the way that we are reporting folks in data and folks are reporting themselves is more reflective of the way that they see themselves on a variety of different data components. It also comes through by helping to locate where folks are, where they're receiving services, and what those catchment areas are. It enables us to both look at issues that might not be as top of mind when we're looking at issues of equity, like rurality, and how do we support our rural communities and folks in rural areas. But it also helps us start to dig into things and how we can better support disaster response, especially responding to disasters in an equitable fashion. So this is mutually reinforcing and supportive of ACF's focus on equity throughout the data strategy.
Thanks, Beth Ann. And there's a follow-up question. Are you thinking about, as you're thinking about open access to data, how are you considering impacts on communities for whom data has been historically weaponized? For example, AIAN communities. Will there be waivers available if we are unable to share data to maintain our partnerships?
Yeah, so this is where we don't want to undersell our commitment to being moral throughout this process, right? We will only be releasing data so long as it does not undermine the privacy and confidentiality of individuals or communities. And we're also working through on how we can present information responsibly and in ways that don't support the weaponization of data. So that's an ongoing conversation, and it's going to require us to take a detailed look at any particular data release to make sure that we're doing so in a way that's consistent with and supportive of communities, and honestly telling the story in a representative way that doesn't unduly harm or support harm for communities as we're working through the data use and release.
Will there be more disaggregation of data to support equity efforts?
It's one of the things that we want to examine quite closely. Again, we only want to disaggregate to the extent that it is supportive of the broader and more accurate understanding of the situation in communities, and we will not be doing so in ways that compromise privacy or confidentiality. And as we all know, disaggregation and the level of disaggregation is something that can become tricky quite quickly, especially when we're looking at small groups of people, in particular, like small cell sizes. And with the growth of the additional information that's available publicly, and the inadvertent ability for folks to be able to take data from multiple sources and re-identify individuals, however unintentionally, that's sometimes referred to as the mosaic effect. Again, it's one of those things where we need to take a look at each individual data release to make sure that we're doing so morally, responsibly, and in alignment with the privacy and confidentiality protections.
Great, this one's for Kevin. How is ACF planning to specifically use AI integration in ACF data strategy?
Yeah, great question. So we're still starting our AI practice. I mean, similar to what Beth uncovered before, we're hiring an inaugural chief data officer. We're standing up very quickly our artificial intelligence practice because we quickly see how important this is going to be to the future of kind of how we're shaping our organization and how it delivers. The thing I'll say about AI is it relies on good data, right? So if you feed artificial intelligence bad data or data with bias in it, it leads to bad results, right? And so we have to be very cognizant and careful that we are using AI responsibly with our data to leverage and improve mission outcomes. In my mind, I think AI has a strong potential for improving and lowering administrative burden in some of our execution and delivery of programs, allowing us to kind of see insights that perhaps we couldn't see through traditional means, and really gaining a broader understanding and kind of focus on how to better serve the constituents within the Administration for Children and Families. So AI is really, especially generative AI, traditional AI has been around for quite a while. But it will kind of shape and we will be releasing kind of strategies and representations about where we're headed with artificial intelligence soon thereafter. The things I'll say is, right now we're defining a lot of principles, and there are things like not doing harm using artificial intelligence, making sure it's safe and secure, making sure that we're fair and civil in our use of artificial intelligence, and not if you've read the executive order, there's discussions about rights impacting and safety impacting artificial intelligence. In the case of ACF, a lot of the things we have to consider is about rights impacting uses of artificial intelligence. And then finally, our opinion or our kind of view on artificial intelligence is it really augments and supports humans. It doesn't replace kind of insights. We're the human services side of HHS, the big ecosystem that supports our nation's health and supports our nation. And so it's really important that these are augmenting and supporting decision-making, not replacing decision-making by humans. So I hope that gives you a broad sense of kind of where we're headed with artificial intelligence, and it connects with our data. So it's a partnership, and we will work hand in hand to make sure we have good quality data and we use AI responsibly to gain deeper insights.
And if I can just build on that a little bit, come December of this year, the entire federal government will be releasing its AI use case inventory that details, here's how we have been using artificial intelligence, intersecting with the data strategy. Our data search support team has been experimenting with ways in which low-risk applications of artificial intelligence can also reduce the administrative burdens for our own staff. And so we've had a couple of successful cases of doing that internally, which folks will learn more about when that inventory is released.
Thanks, Kevin. Thanks, Jane. Appreciate it. Another question we have, what are some technologies you're looking at to achieve interoperability, and how important is it that to reducing the number of children that reach unsafe locations? Kevin. Yeah.
So, yeah, I'll take that one. So what technology, it's a combination of both, I think interoperability, if you think back to when a lot of the standards were established around health, I think we didn't have quite the sophistication of artificial intelligence applications and kind of wherewithal that we do today. That being said, we need to still develop kind of standards to make sure that interoperability is effective. Going back to that kind of high quality data concept, if we're all defining things in different ways, we're not going to be able to support kind of connecting databases and technology. So it's part standards, but I do think in the realm of technology, artificial intelligence really gives us an opportunity to maybe ease the burden of connecting across data sets. And so one of the things that if you've been following kind of our SAM.gov, we asked very specifically about the nexus between artificial intelligence and interoperability, because we do see that there's a lot of potential where AI could potentially, help us solve some of these challenges of connecting disparate data sets. That process is still in development, and we'll be working very soon to engage the public on interoperability and what that means in the human services ecosystem.
Thanks, Kevin. Next one's also for you. Do you anticipate procurement processes to create new technological platforms for ACF?
Great question. I would say yes, and your best place for that information is going to be sam.gov. So when the federal government buys products, we post those solicitations on sam.gov or GSA eBuy. So if you're in the federal contracting community, I would strongly encourage you to check out those sources where we will kind of post everything from RFIs, so like kind of help us get our idea right, to RFPs and RFQs where we go down the path of saying we want to buy, this thing, whatever this thing is. So no specifics there, but again, each action will come out on sam.gov and you'll be able to read and, bid on that opportunity to help us shape our technology platforms.
Thanks, Kevin. Last call for any other questions. Other comments or remarks from anyone? Okay, well, thank you so much to those of you who joined us today. We really appreciated the conversation and hearing what you all are interested in as well. We will be posting this recording and the slides on the Data Strategy webpage as soon as we're able to. So look out there, and we'll send out an email as well to those who registered with the recording and session. Thank you all.
Thank you.